Welcome in. I'm Jeremy Kahn from 105.7 The Fan. Appreciate you being with us. I want to talk to you about the Orthopedic Associates of Central Maryland, member of the Centers for Advanced Orthopedics. And with me today, we're going to talk to specialists in physical medicine and rehabilitation. We have Dr. Gurtej Singh, MD, and Dr. Michael DeMarco, DO. All right, I got to ask you, what does the DO stand for? What's the meaning behind that?
Osteopathic medicine was born in the late 1800s by Dr. Andrew Taylor Still in response to some of the things that were going on in conventional or allopathic medicine. He was focusing on a more holistic approach and specifically the neuromusculoskeletal system and harnessing the body's self-healing capacity. Over time, the two forms of medicine have become very similar, but we maintain separate medical schools. So we have some separate medical training, and then during our residency, we intermingle, and DOs practice medicine and perform surgery in all 50 states.
Well, let's talk about physical medicine and rehabilitation. And I had a chance to talk to you guys. I have my back issues, so we'll get into it. But tell us, Dr. Singh, what is it that you actually do?
Physical medicine and rehab is a younger specialty when looking across the spectrum of medicine. It started in the mid-40s as a response to all of our veterans coming back from World War II and trying to help those with musculoskeletal injuries, amputees, brain injuries, spinal cord injuries, and of course has evolved to now encompass spine and spine care. We also do things like EMG nerve conduction studies. We even take care of geriatric patients who've had strokes. So it's a wide encompassing field. At the Centers for Advanced Orthopedics, the physiatry staff members tend to focus on spine care and pain management.
Yeah, and I want to get to that because, you know, in the conversations we had, my back issues, I put off surgery for a long period of time, and I've heard many, many horror stories, and everybody you speak to has a different story, whether it went well, whether it went bad. What are some of the horror stories that you've heard, and you know, regarding back pain and some of the spinal injuries?
We've certainly seen horror stories, but we've also seen some success stories. Back pain gets everybody's attention because it is so painful. We don't have great sensation in the spine like we do in our fingers. We know exactly what's going on, but when something goes wrong, we sure know what's going on in the back. It can be exquisitely painful. Also, it's extremely common. About 90% of people are going to have some problem with their back over the course of their life. One of the reasons that back pain is so common is the spine is just at a mechanical disadvantage. I believe we have a picture of a spine here, and you see there's some natural curves in the spine. It's a mixture of bones and discs that are linked together. And throughout that entire spine runs a bunch of nerves. So when something goes wrong in the back, sometimes it pinches upon a nerve, and nerve pain is also extremely painful.
And that can affect different parts of the body, right?
Very much. One of the most challenging parts of our job is to figure out if the pain is coming from the neck or the shoulder, or if the pain is coming from the lumbar spine or maybe the hip.
Yeah, it's one of those tough things, you know, trying to figure out the diagnosis and making sure you get it right, because that's probably where a lot of these horror stories come from.
A lot of times it's also expectation management. You know, unfortunately, we're all getting older, all of us, and so we're not moving as well as we used to. Some of us still remember those days playing sports, still try to push ourselves on the weekends.
You might be talking to me directly here, so.
And you know, the reality is we want to set expectations for what the spine can do for patients as we all get older, so that we can just maximize their function. If we can keep you doing as much of what you want to do, you'll have a better quality of life.
So what can you do to kind of help these people? In what direction do you take them when somebody comes in?
So the first thing is always the history and the physical exam. Asking patients directly where it actually hurts, and then where that hurt goes. And then the second set of questions is, what does it feel like? Just getting that information out of a patient really helps to tease us, is this something that's related to a disc? Is it related to a pinched nerve? Or is it the facet arthritis, or you know, that aging process that we all try to avoid as we get older?
What are some of the common conditions that you've seen coming into you?
One of the most common things that we see is from the normal aging of the spine. As the spine ages, the discs will lose water content and they will lose height, and then that starts to put pressure on some of the structures in the rear of the spine called the facet joints. You can see on the picture in the left, that's what a normal, healthy-looking spine looks like. Big, thick discs with a large blob of water in the middle of it. In the picture on the right, you can see how the discs are dried out, cracked, and they start bulging. Patients with arthritis of the spine, they typically have a lot of pain in the morning. They have a lot of stiffness after inactivity. That pain rarely travels into the extremities. They're usually successfully treated with things like physical therapy or maybe some low-dose medication. If that doesn't work, we have several procedures we can do for those patients. Some of them are injecting cortisone into the painful joints, and if that's not helpful, then we can actually deaden some small nerves around those painful joints, and that is called a radiofrequency ablation, and it can work very well and last long term, potentially for years for those patients.
Yeah, it's something I've had done, and you and I had the conversation about it, but and I was telling you I have stenosis. How common is that?
Stenosis is a natural consequence of the aging of the spine. As the joints age, they typically enlarge, and the spine not only gives us length, but it's also a conduit for nerves. And as those joints start to enlarge forward and those discs start to bulge backwards as a result of the arthritis, it starts to pinch upon those nerves. Patients with stenosis typically have difficulty standing for any period of time or walking long distances. These are people that can't get into the store fast enough to grab a shopping cart, so they can just kind of lean on it. As the spine leans forward, it tends to open up those spaces a little bit, and then standing up puts pressure on the nerves until ultimately they have to sit. Again, those patients, the most important treatment is going to be some type of exercise therapy, and hopefully even some prevention, younger people, to prevent this from becoming a problem when they're older. We also do intermittent epidural steroid injections for those people, and it gives good but temporary relief. Surgery is available for those patients when their walking distances just get painfully short and they start staying at home all the time because they don't want to be up.
What about some of the common conditions that you see come in?
So pinched nerves, what is very commonly known as sciatica, is probably one of the most common things that I see, both of the neck and in the lower back, radiating down to the feet. The MRI tends to be the best test that helps us understand which discs are herniated and which specific nerves are compressed. Just as Dr. DeMarco references, we offer patients the complete, as I call it, buffet of treatment options, right? So there are things like medications, physical therapy. We'll send patients to chiropractors, but at the same time, there are injections that when patients have a brand new herniated disc, and what happens is it's not just that it herniates or that it bulges out of position, but there tends to form a tear in that part of the disc. The inner jelly, and you sort of think of it like a jelly donut, right? So that inner jelly is very inflammatory, causes lots of pain on that nerve. And a lot of studies have been done in the operating room where you see the actual normal color of the nerve having that yellowish tinge and the irritated nerve almost purple in color. Just because of how irritated and inflamed that inner jelly is on that nerve. And so the patients will give you that numb, tingling, burning pins and needles all the way down to their toes.
One of the things I want to get into is what are some of the conditions that you treat? How does that work for you?
So actually what you have is certainly one of the most common things that we see. How a patient comes in and says, so I've been told I need back surgery, how can I avoid that? And I think both the field of physical medicine and rehabilitation as a non-surgical forward field really helps keep guys just like you playing basketball, playing flag football on the weekends and kind of out of the operating room as long as possible. There are new minimally invasive techniques that are coming to the forefront of spine, and kind of taking care of patients with spine pain is going to become very exciting over the next probably 5 to 10 years. The advancement of regenerative medicine, as well as these what we call micro spine surgeries, so inserting small devices to kind of keep the spine open and therefore just prolonging, unfortunately, the inevitable. But in a young, athletic, healthy, otherwise patient, we would hate to hear that you've already had back surgery.
How often is misdiagnosis those happen? I mean, is that something that's very common in the field?
Well, taking care of patients with spine pain is very difficult in general. I think I heard a colleague once say, when asked, "So what do you do?" And he said, "Really, I'm just a detective." When people have a torn rotator cuff or a torn ACL, it's pretty obvious. The MRI confirms it, the weakness on the examination confirm it. Patients go in, they have the rotator cuff fixed, they have the tear in the ACL healed, and they go back to being who they usually were prior to their injury. Back is a progressive problem. And so it's not very common that a patient will get to revert 20 years back to how their back felt. It's just managing them going forward.
So here's the key for people that are having back issues and want to find you guys. How do they find you?
We have offices in Catonsville, Columbia, and Eldersburg. Those offices are fully staffed. We do physical therapy there. All the doctors are located there. We have imaging on site. Anything that's needed, we can do at those offices. We can be reached through our website, www.mdbonedocs.com, and our phone number is 410-644-1880.
How about you? Any same thing? They find you the same exact way?
Yep, find us the exact same way. Some of us are also on Facebook and Instagram. We love to use those platforms as a way of better educating the public. There's so much misinformation out there. Had a patient earlier today that said, "So I was on Google," and you kind of cringed, wondering what's coming next. We like to use social media not as a place to give actual one-on-one advice, but just to get good quality information out there, help patients understand better just the complexity of what it means to treat spine pain.
I got to say, this has been, and don't tell the other doctors this, one of my favorite ones that we've done, because this is definitely in my wheelhouse and has been informative, and plenty of things that I've learned that I didn't know already, even with some of the processes I've taken to try to maintain this issue. But I want to thank Dr. Gurtej Singh and Dr. Michael DeMarco for coming by, and again, you can check those guys out. It's Orthopedics Associates of Central Maryland, member of the Center for Advanced Orthopedics. This has been Specialist in Physical Medicine and Rehabilitation. Thank you for watching.